Hello, everyone. I'll just take a couple of moments for people to join in. You'll notice in the chat, there is some information about how to find more information about the PKD Foundation of Canada and about our new platform, My PKD. I'd like to start with a land acknowledgement. I'd like to acknowledge the traditional territories of the Indigenous peoples across Canada. We're grateful to live, work, and learn on these lands, and we recognize the importance of honoring and respecting the histories, cultures, and contributions of all Indigenous peoples. Thank everyone for joining us today. We're so glad to have you for today's webinar, Medical Trauma and PKD. This is an important topic, and we're grateful that you're here to learn and engage with us. Before we dive into today's session, just a couple of quick housekeeping items. This webinar is being recorded, and a link to the video will be sent to all of the registrants within a week or two, so you can watch it again or share it with others if you'd like. And we will be having a live question and answer session after Joy's presentation. So feel free to submit your questions in the comment area or in the Q&A area at any point during the presentation, but we will probably answer them after Joy is finished presenting. So a quick summary of what we're talking about today. We're focusing on an important aspect of living with PKD, medical trauma. For many individuals living with PKD, medical procedures, treatments, and the emotional toll of chronic illness can have a significant impact. So in this session, we'll explore what medical trauma is and how it affects people with PKD, and some practical strategies to manage the emotional challenges that come with it. I'd also like to quickly mention our new online community, My PKD, and there's a link for a sign up in the chat right now. It's a safe and confidential space for people affected by PKD to connect with each other, access helpful resources, and get support. So if you haven't joined yet, we encourage you to check it out after today's session, and a sign-up link is included in the reminder email that went out to everyone earlier today. We're so happy to have Joy Pekar with us today as our speaker. She's a registered psychotherapist qualifying, whose professional practice is deeply informed by her personal experience. Joy's family has been directly impacted by PKD, which has included navigating the emotional complexities of dialysis, transplant, and the search for a kidney donor. With this firsthand understanding, Joy helps individuals and families cope with the emotional toll of chronic illness, particularly kidney disease. She offers compassionate support and mental wellness strategies to help people live their best lives, despite the challenges they may face. With that, I'm excited to turn it over to Joy. I know that this will be a popular topic, so thank you again for being here, and we hope you find today's session helpful and empowering.
Well, thank you for that lovely and warm introduction. I always enjoy speaking about mental health and chronic illness, but particularly doing that with the PKD Foundation of Canada because I have a deeply personal connection. So thank you so much for organizing this and for having me speak today. I'm just going to set up my screen to share. Is everybody able to see the slide okay? Wonderful. All right, thank you. So today we are talking about medical trauma and polycystic kidney disease. I want to, oh my goodness. As you've heard, my name is Joy. I'm a registered psychotherapist qualifying. I have presented relatively recently with the PKD Foundation on mental health and kidney disease in general. If you attended that presentation, you may notice some overlap in the content, I wanted to let you know that today we're going to be really focusing in on trauma and how it impacts PKD, and any areas of overlap that exist we'll talk about really quite briefly. And the main reason for that, a couple of reasons. One is we really wanted to focus on trauma today. And two is that previous presentation is available on the PKD Foundation of Canada's YouTube channel. So at some point today, we'll dig up that link for you and throw it into the chat so that if you see something today or hear something today that you'd like to know more about, and I mentioned that I've spoken about it previously, that'll be where you'll be able to reach that. I also wanted to point out, there are a lot of registered psychotherapists and registered psychotherapists qualifying in Ontario. Why me? Why am I the person here sitting in front of you talking about trauma and PKD? And as was already alluded to, I have some real world credentials and life experiences. My husband and his mother both have polycystic kidney disease. It's a genetic condition. They both went into kidney failure quite young compared to most other people who have PKD. They were both in their late 30s. They both went on dialysis and they both had transplants. My husband's transplant was successful immediately. The doctors refer to it as a textbook transplant, and his life is forever improved by that. His mother had 3 transplants, and all 3 of them failed immediately. None of them were successful for her. She had many, many complications related to her PKD, related to her transplants, related to dialysis access points. And so as a caregiver, as somebody who's very close to polycystic kidney disease, and as somebody who's seen a lot of medical trauma in polycystic kidney disease, I can speak not only to what we know about mental health and what we know about trauma, but I can speak very specifically to how that can impact people in a really profound way. Of course, everybody's experiences are different. And so my story is not to say that it's the same as anybody else's story, but just that I have perspective that I think a lot of other therapists probably don't. Our goals for today are to really understand medical trauma. We'll talk about trauma in general and about medical trauma specifically, and about medical trauma in PKD specifically. That'll be a pretty big chunk of the conversation. Then we'll talk about what we can do about that, focusing first on what each individual person or family can do, and then also exploring the kind of help that's available out there for people experiencing or who have experienced medical trauma. This is a slide you may have seen before, and this is a framework that I always consider whenever I talk to any person that I'm supporting about mental health, because there's not one thing that makes up who you are. Your PKD does not define you. Your identity is this intersection of so many different aspects of who you are. Your gender is part of your identity, where you are in your illness, your stage of life, how old you are, your race, your culture, your religion, your socioeconomic status, if you live somewhere urban or rural. There are so many aspects to what makes up your identity. And that's important for a lot of reasons. And today we're going to focus on why it's important with respect to medical trauma. Okay, so medical trauma is, it's a type of trauma. And what that means, it's not about the event itself, but it's about a person's response to that event or series of events, which we'll talk about as well. So trauma is your response emotionally, psychologically, and even physically to distressing or life-threatening events. Like I said, medical trauma is just one kind of trauma, and it's a trauma that is caused by experiences with medical events. All of the same concepts that apply to trauma in general apply to medical trauma. And there's some really interesting research on this, and even specifically PTSD. PTSD is a diagnosis. It stands for post-traumatic stress disorder, and that's something, again, that we'll talk about in more detail. Not everybody who experiences trauma has PTSD, but there is some really interesting research on PTSD and how it can, how people who have experienced traumatic medical events are at increased likelihood of experiencing symptoms of PTSD. Things that have been particularly highlighted are people who have had experiences in ICU, people who have had experiences being intubated and had assisted breathing, people who have experiences with delirium as a result of a medical challenge, and people who have had organ donor transplants, including kidney transplant and any other solid organ transplant. And then another group that's been actually quite extensively researched is postpartum. People who have had traumatic births are also, potentially may have PTSD as a result of those medical traumas. And it's not just the individual themselves going through the medical challenges who may meet criteria for PTSD, but their caregivers as well. Being a witness or having a loved one go through a traumatic experience puts you at risk for trauma. And so we'll also be focusing a little bit today on caregivers and the impact that trauma can have on caregivers. Research is highly varied for a lot of reasons. Part of it is how the research is done, and part of it is the definition of trauma or the definition of PTSD that they use, and we will talk about that a little bit more. But I want you to know that in some studies, it can be as many as half of the people who are exposed to medical trauma meet some or all of the criteria for PTSD. So this is a very, very real challenge. It is not something rare by any means. And so it's something that is important for us to better understand and be aware of as you go through your own journey. Okay. A lot of people think about trauma as being like a very clear and concrete thing. So, if you have a very serious accident or a car accident or a very serious injury, or if you're involved in a very violent situation, people would define that as a traumatic event. And I think people then have a tendency to lump all other events into not traumatic events. And I would encourage you to think, particularly in situations of chronic illness, as trauma being on more of a spectrum. So when we conceptualize that stressful events can come in like a little bit stressful, a medium amount of stressful, very, very, very stressful, and traumatic. And even that, like there's no clear categories to it. In fact, having one singular very traumatic event we know can lead to PTSD, but we also know that having many persistent and unpredictable, very stressful events that may not fit neatly into the category of a single traumatic event can also lead to symptoms of PTSD. So the bigger question isn't if you had it, in my opinion, again, different people have different opinions. The bigger question isn't if you had a singular traumatic event that you've experienced, but more so the impact that your experiences have had on you is what we need to be thinking about. So when we think about the impacts of trauma versus what people would describe as the impact of stress, stress feels challenging but manageable, and trauma feels like you're unable to cope. Stress usually has an impact that's relatively short term. So you have a stressful event, have potentially very strong emotions about those events, and then when the emotions have passed and you've within the same day or the next day, you start to feel your stress come down. Whereas for traumatic events, the impact is long-term, weeks, months, or years. Stress can feel motivating. So, just the right amount of stress makes you want to make a change. It can also feel disruptive. Something happened and now you've had a really bad day, whereas trauma feels completely debilitating and paralyzing. Stress can lead to short-term fight or flight response. So, you're in a situation that is very stressful and difficult, and you may feel inclined to run away from it or have an argument or other types of fight or flight responses. Whereas if you're feeling the impacts of trauma, you may be feeling very long-term fight or flight responses. Stress is usually improved with rest, and trauma is very often not improved with rest, and in some cases may benefit from having professional support. Again, I know I literally just said, please don't think about this as being black and white or on and off. And now I'm giving you a list of like, this is stress and this is trauma. So I acknowledge completely that I've made something binary that I just told you was not binary. And I just am using this as a reminder to illustrate, you may land somewhere between these. You may land some days in this category and some days in this category, and that's okay. In fact, it's normal, especially when you're dealing with a chronic health condition. The question is, if you're noticing yourself falling in the category of things under the trauma category, then you may want to be asking yourself if this is something you want to explore more deeply for yourself. Symptoms of all kinds of trauma, really, are that certain things will trigger you. And that could be a sound, like the beeping in the hospital, or a smell. So hospitals have a very, very specific smell. It could be a sight, something that you see. Somebody I spoke to, needling, obviously in dialysis is something that's very frequent. And some people may be triggered by any needle, like even a sewing needle could trigger a reminder of traumatic events. Other symptoms of trauma are your emotions. They might be very, very heightened. And your thoughts, which might be very intrusive. So you may have a lot of recurrent nightmares. You may have intrusive memories. The triggers might trigger those intrusive thoughts and memories. Things that, in theory might be innocuous, like crushed ice. If you have a glass of crushed ice, that can bring you back to being in a hospital where you're not allowed to eat yet, but you've been given crushed ice. You may also have physical symptoms, which can be, you might have digestive problems, you might have changes in your heart rate, you might notice changes in your sleep. Another thing I forgot to mention about thoughts is you may have difficulty concentrating. You may also have difficulty remembering the specifics of the trauma you experienced. And then from an emotional standpoint, you might feel angry, you might feel irritable, you might feel sort of numb and detached. Everybody's different. You might feel hyper aroused, really jumpy around other people. And then you may notice some behavioral changes. You may want to avoid medical care. It's a lot of people who have medical trauma don't want to walk into a hospital, don't want to walk into a dialysis clinic, don't want to walk into their doctor's office. And there's a lot of reasons that that might happen. A lot of people with trauma in general may engage in some dangerous behaviors, and they may become aggressive. And that's just, how their brain is coping with the trauma that they've experienced. We do know that if you start to notice any of these signs, that seeking help earlier has been shown for many people to be more effective. So if you start to notice these things in yourself, if there's somebody you feel comfortable talking to about it, if you have a primary care nurse, your general, your GP, your nephrologist, talk to somebody. If you are open to therapy, the sooner that you get help when you notice signs of trauma in yourself, there is some evidence that earlier intervention can be helpful. Okay, I want to talk briefly about PTSD as a specific diagnosis. so that people are aware of it. I want you to know that this presentation is not going to focus on PTSD specifically, but on trauma in general. And the reason for that is that the diagnostic criteria that they use, there's a book called the DSM, the Diagnostic and Statistical Manual, and every few years they rewrite the book and they change the requirements, and medical trauma in most cases would have met criteria for PTSD in the DSM-4 and does not meet criteria for it in the current version, which is the DSM-5, because certain health conditions, they've made it more specific basically, which means that a lot of people who have medical trauma no longer meet the criteria. I These are the same people with the same challenges that 10 years ago would have gotten a diagnosis and today wouldn't. And I'm under the impression that that may very well be edited again. What we know about the DSM is that its often main purpose for existing is around providing services, who gets approved for what, and where funding goes through, and insurance. And I'm like, in my role, don't focus on diagnoses. I focus on the person in front of me. And if you're showing signs of trauma due to medical things that have happened in your life, it does not matter to me if you meet criteria for PTSD now or don't. We're going to work on whatever it is that you need to work on. But so that you know, the criteria for PTSD is exposure to actual or threatened death, serious injury, or sexual violence. And again, because of how they define threatened death, that's why some medical criteria don't count. But anyways, more importantly though, it can be direct or witnessed, which is interesting. It tells us that caregivers and healthcare providers who are witnessing this are at increased likelihood of having PTSD and would meet the criteria if it's actual or threatened death. Another thing that's really interesting about this is that patients who have PKD often witness very serious health events in the people around them when they're in the hospital. It is not uncommon if you've had a stay in an ICU that you've witnessed an ICU death of another patient. It's sadly not uncommon that if you've been dialyzing in a dialysis unit for a very long time, especially in a hospital unit where people tend to be more unwell than in a community clinic, that you may witness a death of somebody who's dialyzing. And that is absolutely, even though it's not an event that happened to you, witnessing traumatic events can be traumatic. Another part of the criteria for PTSD is what they refer to as intrusions. And intrusions is when the thoughts of the traumatic event come back to you. And that can be in a flashback or in a nightmare. Avoidance is part of the criteria for PTSD. Impact on moods and thoughts, which we've already talked about, and impacts on behavior and relationship that we've already talked about. There are three main categories of trauma. Acute trauma is having a single traumatic event. So that could be a natural disaster, violent event, a collision or accident. Chronic trauma is the result of having multiple exposures to distressing situations, which could include ongoing abuse or prolonged challenges. And complex trauma is the result of multiple very traumatic experiences, and very often it starts early in life. It should go as no surprise that a lot of what I've talked about already in terms of trauma can relate very, very specifically to the experiences of people who have PKD. There's a huge amount of uncertainty that exists with any chronic illness, and certainly with PKD. Examples of acute trauma in PKD are a transplant, if it's successful, or failed transplant. It can be potentially traumatic. A nephrectomy, or like I said, witnessing the death of another patient. An example of chronic trauma is dialysis. We're told it's necessary, it keeps you alive, but if you're somebody who is not comfortable with needles or really struggling to sit still, or the smells of being there, the sound of the dialysis machine will forever be ingrained in my brain. The way that wheel turns, like there's just sort of a clicking sound, and that's forever ingrained in my brain, because it was something that I was exposed to chronically over and over and over again. That doesn't mean that I have PTSD, but it does mean that I was exposed to something that was chronic and traumatic. Complex trauma in PTSD could look like, if you've had repeated clots, repeated complications, the fear of being immune compromised, the fear of having repeated aneurysms or other complications. If you've had episodes of rejection, these are combinations of multiple events over long periods of time, that could absolutely be examples of complex trauma. Now, that's again not to say that every single person who experiences these things has experienced them in a traumatic way. What's traumatic for one person might not be traumatic for somebody else. We don't get to define and say this fits into a trauma category and this doesn't. An event is a traumatic event for you if it feels traumatic for you. I want to talk a little bit about medical gaslighting. Um, so gaslighting is, if you're not familiar with the term, when somebody is dismissive, or a system is dismissive of somebody else's experiences or emotions or both. And this happens in a lot of different spaces. And we're really starting to understand what people have been saying for years and how much this happens in medical spaces. When a healthcare provider dismisses or minimizes symptoms, concerns, or experiences, that's medical gaslighting. If you think back to that intersectionality slide of identity where we had all those circles, there is actually a lot of research that shows that women, people who are gender diverse, people of color, and people who are Indigenous are at a much greater likelihood of experiencing medical gaslighting. So if you've ever walked into your doctor's office and felt like your doctor didn't believe you, then you may have experienced medical gaslighting. If you feel like that happens to you all the time and you fit into one of those categories of people it's more likely to happen to, then you may very well be right. In PKD, this is somewhat less likely to happen than other types of chronic illnesses because the blood work doesn't lie. Your creatinine is what it is. Your kidney function is what it is. Your kidney volume is what it is. However, I do see this a fair bit when people report pain in PKD, especially if they're in sort of the quote unquote earlier stages of renal failure. So people who are in stage 2 or 3 or even 4 of kidney disease, doctors will often say, no, chronic pain isn't part of PKD, or flank pain that you're experiencing. If you didn't have a ruptured cyst, that's not a thing that happens. And yet, so many patients with PKD have told us that it does happen. So pain, because it's subjective, because the blood work can't show it, is definitely more susceptible to medical gaslighting. There's also some really interesting research that is showing that medical gaslighting itself can be a form of medical trauma, which goes counterintuitive to the current definition of PTSD. However, we know that medical gaslighting impacts emotions and thoughts. And, it checks off all the boxes that are associated with PTSD. People have intrusive memories of being gaslit by medical professionals. It impacts their mood. It makes them doubt themselves. It makes them more reluctant to go to the doctor and seek medical care because they don't think the doctor's going to believe them. And we know that when patients have these experiences where they're questioning their doctor or they don't have trust in their medical professionals, they'll get labeled as difficult or non-compliant. I remember walking into an medical visit with my husband when he was approaching dialysis, and his regular nephrologist introduced the two of us to his dialysis prep care team, and he introduced me and said, "This is Joy, and she is a strong advocate." And like that just spoke volumes in terms of what he thought of me and um, and our relationship. So yes, if you've ever been described as difficult, non-compliant, or a strong advocate, there's a possibility that medical gaslighting might have been part of your experiences. Might not. I'm just putting it out there as an option. All right, let's talk about caregivers. Um, the role of caregivers in PKD cannot be overstated. It's huge. Um, a lot of people who have PKD might feel a lot of guilt about the impact on their caregivers. Um, it can be even further complicated when a caregiver is also an organ donor. Um, and the impact that has when the transplant is successful versus the impact that has if a transplant is not successful. It can't be overstated. It's huge. It's huge. Um, Caregivers can have their own trauma, because, like we talked about, witnessing the trauma of others can be traumatic for some people. Caregivers can have their own trauma. Again, in the case of a failed transplant, that is a hugely traumatic loss for both the potential recipient and the donor. Um, at the same time, when we think about medical gaslighting, there have been cases where sometimes caregivers with the best of intention are also inadvertently gaslighting their loved ones. They may minimize the symptoms, they may tell people not to worry, and usually it's from a place of love, um, but it can feel to some people like their loved ones aren't listening and don't trust them. Um, so I thought it was important to talk about the complexity of how trauma impacts caregivers, but also in how caregivers might, from a place of love and compassion, might inadvertently be adding to some of the stress or even potentially trauma. Um, so when we think about caregivers, I think, and with anybody, it's important to validate whatever a person is going through, validate their feelings and listen without judgment. Um, you may want to have a conversation about seeking some professional help for the caregiver if they need it. Caregivers sometimes need that support. Caregivers might also be the person to notice when the person with PKD needs help and say, I'm really worried about you because, and let's see if we can get some help for you. Caregivers play a really vital role in helping to navigate the healthcare system and be the advocate sometimes. Um, the more that you have that community support, the easier it is potentially for everyone. And caregivers really need to prioritize their own self-care to prevent burnout and help them be compassionate in the times when their loved one needs it most. All right. So what now? We've talked a lot about trauma. There's a lot more to say about trauma. There's no way that in this brief presentation I can cover everything. But I hope that I've given you a sense of what trauma is in general, how stress and chronic stress relates to trauma, how what something that's traumatic for one person might not be for another. So it's not about the event itself, but about the impact that it has on you. We've talked about signs that you might be experiencing things in a traumatic way. And so, I hope that you have a little bit more of an understanding of trauma and medical trauma, and especially how that can impact PKD. But what now? Great. So you understand that this is a thing that exists and might even exist in you. What do you do next? So the whole second part of this presentation is going to focus on what do we do next? We'll start off talking about coping. Usually in presentations, I talk about prevention before I talk about coping. But I suspect that for most people here, at least some of what I've spoken about has hit something and said, I think I noticed that in me. I think I noticed that in me. So if at any point in this presentation so far, you heard something and say, oh, I noticed that in me, then I'd like to talk about coping to say, okay, what can you do next? But then there are some interesting things to consider for prevention. So what can I do in the future to prevent or minimize or mitigate the impact of trauma? And then I also want to talk about interventions that exist. So coping are the things that you do when you notice the signs of stress and trauma. And that's what I was referring to. If you've noticed any of the things that we've talked about in yourself, here are some potential things that you can do. So for starters, awareness and understanding and education are a really important part of coping, because the more you attend workshops like this, the more you learn about trauma, the more you're able to understand signs in yourself and to sort of separate for yourself, this isn't necessarily me, this is my reaction to something difficult that's happened. Um, so the education piece is a really valuable part of coping. The feelings wheel you've probably seen before if you've heard me speak before. You probably can't see this very well on your screen, but I will share the link later if you'd like. But in short, it is a very extensive list of feelings that exist in humans. And the reason I like to bring it up is because there are a lot of things. It can be hard to pinpoint the words for the feelings that we have. And so using a tool like the feelings wheel can help us find the words. Do I feel insignificant? Do I feel inadequate? Do I feel frustrated? Do I feel disappointed? Do I feel inferior or empty? Finding the words for what you're feeling can be healing in and of itself, or at least a first step in healing. It can also help you to communicate how you're feeling with others. Um, and these emotions can happen at the same time. You can be excited and scared at the same time, even though those feel wildly different from each other. Every single person I've ever spoken to preparing for a transplant has shared that they have felt both excited and scared, or excited and nervous, optimistic and worried. And conflicting feelings can coexist. And when you are reflecting on challenging things that have happened for you, stressful things, potentially traumatic things, noticing the feelings within yourself can be part of how you take care of yourself. Self-care we have talked about in the past as well. And if you'd like a lot of detail about that, then check out the link from the past presentation. But self-care is something that everybody needs in their life. Find the self-care strategies that work for you, because what works for you is not going to be the same as what works for me. And like we talked about, stressful situations happen. They happen a lot when you're living with a chronic illness. Balancing your stress with self-care can help. And if you're noticing that your self-care is not working for you, then you might need to ask yourself, do I need different self-care? Do I need more? Or is this more than a stressful situation? Is this a little bit of a traumatic experience? But self-care is an important and meaningful starting point for sure. Another thing we've talked about in the past is grounding. Grounding can be incredibly valuable, for especially in those times when your triggers feel very powerful. So, for example, I recently had to go into a hospital where something quite difficult happened, and just walking in the doors that were the same doors that I walked out of very quickly brought me back to that moment of where I was. So, a grounding example, grounding in general is the act of bringing you back to the place where you are now. And in that case, for me, I grounded myself by saying, I'm here for a different reason today, and reminding myself why I'm there. And I mean, it was just a fairly routine appointment that was not stressful at all in and of itself, but brought me back to a time when I was there for something that was stressful. There are tons and tons and tons of grounding exercises that exist. There are websites, written books where you can look them up. In the previous presentation that I did, I talked a lot about grounding for chronic pain, because very often grounding exercises ask you to explore your body and what's happening in your body. And for people who are experiencing chronic pain, that can sometimes make things worse instead of better. So I won't go into the details of that today. You know where to find it. Um, but truly anything that connects you to the time and place where you are right now. So if I wanted to ground myself in the space where I am right now, I could actually reach over and touch my plant. I could look at my plant and smell my plant and say, this, I'm here in my office with my plant. I'm in this space and this is what is real for me right now. And that reality, when you're encountering triggers, the reality of the present can be helpful. All right. I want to talk a little bit about prevention. Now, you can't prevent stressful or traumatic things from happening in your life with chronic illness. Or at least, they talk about healthy lifestyle and diet and exercise and new medications. Fair. Yes, you can do all those things. However, you're coping with a genetic condition, um, and stressful things are going to happen. And so I think about those stressful and potentially traumatic events as rain. The rain is going to fall. And, maybe some research will help reduce the rain that's falling, and maybe it won't. The rain is going to fall in your life with a chronic illness. What can you do to keep yourself a little bit drier in the storm? And that's sort of what this next bit of the presentation is going to focus on. The truth is that there's a lot that is outside of your control, especially with chronic health. And so we need to start by acknowledging that a lot is outside your control. And we can talk a little bit about what is in your control. And so sometimes what's in your control is attending workshops like this, attending workshops about PKD in general, so that you know more about the different treatment options and feel better prepared for your medical appointments. Maybe it's taking a friend with you. Maybe it's writing down a list of questions before you go to your medical appointments. Maybe it's scheduling dialysis in such a way that allows you to continue working, or scheduling dialysis in a way that allows you to get away for a weekend. Maybe it's requesting virtual appointments so that you don't have to go into the hospital quite as much. I acknowledge that there is a lot that is outside of your control, but sometimes thinking about those things that are more likely to be traumatic for you, if there's anything you can change in your environment to make it a little bit less traumatic, to sort of put up a metaphorical umbrella to keep you just a little bit drier in that storm, then it's worth considering. Some people find it helpful to have specific coping skills during stressful and potentially traumatic events. Deep breathing works for some. I know it can be complicated when you've got really big kidneys, and deep breathing is more challenging. So that might not be the thing for you. Other grounding techniques are good for some for prevention. Visualization is good for some people for prevention. And of course, having a really solid support system is huge for prevention. Now, that might be peer support, like the peer-to-peer group that the PKD Foundation has been organizing. It could be having trusted healthcare allies that you can connect with. So maybe your nephrologist isn't the easiest person to talk to, but your charge nurse is. And so you connect with them where you're able to, and that really helps. Maybe you consider a therapist as part of your support system. All right, I want to talk a little bit about the Tetris effect. There's been some interesting research on Tetris and PTSD. Who would have thought? Um, the research is mixed, so that's why there's a question mark here. That's intentional. There is some evidence that playing Tetris or other sort of visually stimulating games um, may prevent traumatic events from becoming uh, as deeply coded into your brain, if that makes sense. So, part of what makes traumatic events so difficult is that when you're having those flashbacks or those nightmares, you're having a lot of the sensory experience. You can almost see it again, or you can almost hear the sounds again, or almost smell the smells again. And there's something about playing Tetris that it's almost like distracting your visual brain to not allow for the creation of the visual memory to be as powerful as if you hadn't had that there. Like I said, there are a lot of studies in this, and some have really cool and interesting results, and some say no, not really. So um, it's one of those things that there's no harm in trying it, but it's hard to know what the impact will be. Um, Other people have also done studies, again using Tetris. Not as prevention, but as intervention after the fact, and they do it concurrently with other techniques, such as therapy. And one study in particular found that there were changes in the brain, that the hippocampus, which is a part of the brain that's responsible for your fight or flight response, grew bigger in people who had played Tetris as part of their PTSD intervention. Again, not a study that's been replicated enough times to say that this is necessarily scientific truth, but there's been enough conversation about the Tetris effect that I think it's kind of cool. If it's not going to hurt you, if you like playing Tetris and you want to try playing it when you're on dialysis and see if it helps, it's one of those no harm, no foul kind of things. All right. Talking about other interventions, medication is one that's important. Obviously, this is outside of scope for me and what I can do, but I want you to be aware that there are medications that can help at different times in a stressful journey. There are medications that doctors can prescribe before going into an event that is likely to be very stressful or traumatic. There are medications that you can take on an ongoing basis. There are medications that if you're seeing signs of medical trauma after years of living with a chronic illness, that can potentially be effective long term. So if medication is something that you're interested in exploring, then it's best to talk to a physician who is well informed about all the other medications that you're on, and just know that things exist that can help at different times. I also want to speak about therapy. And there's sort of two categories of therapy that are important to consider when we talk about people who have experienced trauma. Um, and they're roughly categorized into trauma therapy versus trauma-informed therapy. So I define myself as a trauma-informed therapist, which means that I understand uh, a fair bit about trauma. Obviously, there's lots more for me to learn about. Um, and that when I work with somebody who has been through traumatic experiences, we center our work together on that knowledge that those events have happened and how that impacts them, and that the impact is valid and makes sense. I would argue that in this day and age, every single therapist should be a trauma-informed therapist. Um, but then there are also specific trauma interventions or trauma therapies that exist that require very specific training to implement. At present time, I am not trained in any of those specific interventions, but there are therapists that are. Some of them have a lot of experience with medical trauma in general, or trauma in general and medical trauma specifically. Um, and so it's important when you consider, if you want to explore therapy, are you looking to try a specific trauma therapy, in which case you would be looking for somebody who's trained in that specific trauma therapy, or are you comfortable working with a trauma-informed therapist who can offer compassionate care and understanding the impact of your trauma, but not offer those specific therapies? Here is a non-exhaustive list, there are more, of some of the most common trauma therapies that are currently being used. I won't go into them in detail, but I'll say very briefly, eye movement desensitization and reprocessing, or EMDR, and brain spotting both involve how you use your eyes in therapy while you talk about traumatic events. Um, Prolonged exposure therapy uh, requires you to be exposed to the things that that might be triggers usually. Cognitive processing therapy and cognitive behavior therapy are related. They talk about, your thoughts about your traumatic events. Trauma-focused CBT is another offshoot of cognitive behavior therapy. Somatic and polyvagal therapy have some overlap as well. They both focus on your experiences in your body. So if you are someone who notices your heart rate increasing, you're sweating, you have butterflies in your stomach, somatic therapy and polyvagal therapy would both address those. Narrative exposure therapy focuses on telling your story and using that as a way to change the impact that story has on you, because your story will always be part of you, but the impact it has can be different. And ketamine assisted therapy and psychedelic assisted therapy use medications that are quite powerful as part of the therapeutic process. All right. So I just threw a whole lot of stuff at you. I did it pretty quickly. Um, I hope that today was interesting for you. I hope that if you saw yourself in some of the things that I talked about, that it validated for you that your feelings make sense. You know, every person is impacted differently by the life experiences they have. For some people, the transition to being on dialysis feels manageable, and for others, it feels absolutely horrific. And I'd say, maybe for most people, it's somewhere in between those two extremes. Um, Transplants can be beautifully successful and horrifically unsuccessful, and everything in between. And even the transplants that go absolutely perfectly can still be traumatic for people. The experience of being in a hospital, the experience of being misheard, those impacts are very deep. And I hope that there's also a little bit of hope for you, that you can, there are things that you can do. There are things that you can do today to make this a little bit easier. There's things you can do in the future to make things a little bit easier. And there's help available within the team that you have right now and beyond that team. So thank you.
So much, Joy. We now have time for a live question and answer session. If the people attending have any questions, we also have some that were asked when people registered, if there aren't any here now. I can see there's someone saying, thank you so much, Joy. That was wonderful in the comments. So thank you, Joy. Yes. So people, you can put a comment in the chat area if you'd like, or in the Q&A area. I think I'll start out by mentioning something that you didn't necessarily, a life situation that Joy might not have touched on is parents with infants or young children who are diagnosed with PKD, and kind of the unique experiences that those parents go through. And is that something that you would just sort of, for the help of people who may not have ever felt acknowledged or validated in those traumatic experiences, Joy?
So first off, thank you for bringing that up, because obviously parents are primary caregivers, especially in ARPKD when people are impacted so young. I was blown away by one study in particular of the experiences of parents um, of kids who have organ transplants, and the traumatic impact that that has on the parents is absolutely staggering. Absolutely staggering. A lot of those parents meet criteria for PTSD. Um, and we know that, particularly in ARPKD, it's not just about organ transplant, that ARPKD impacts so many different things in a little baby's life or a young child's life. Um, and so there's that very like chronic, persistent stress that exists for those families, and that they are strong, strong advocates. And I hope that they're getting all of the medical support that they need, but there may be time when they are being gaslit about their children's care, or they may be gaslit about their own care. Um, Also, the knowledge that that the child has inherited those genes from them is profound. So thank you for bringing it up, because it was on my list of things to talk about and I forgot. So I'm really glad that you asked, and it's huge. It's huge.
And again, I'll invite people. We haven't had any live questions yet, but if people do have questions, please feel free to drop them in while we have Joy here. Another thing I wanted to touch on was, and you did mention it in your presentation, was organ donors and the experience, whether you're a close family member or whether you're even a stranger donating, and finding out that the transplant has not been successful. I think is something that often isn't looked at or isn't anticipated ahead of time, I guess.
Yeah. So I can share that uh, my husband got a living kidney donor transplant, and so we got to see that process very deeply. And one of the steps in that process is explaining to the donor that this might work and this might not work. Um, and, they shared the probability and statistics, and um, some hospitals go so far as to say, well, what if the recipient doesn't take their meds and that's the reason it fails? And would you be able to cope? And, anyways, that's a whole other kettle of fish. And truly, yes, they tell you that that's a reality that can happen. But at the same time, it's not something that anybody's ever actually prepared for if it does happen. Knowing that something's a possibility is not the same as being emotionally prepared for it. Um, and so, absolutely, that can be, you know, I don't want to say like traumatic, because something that's traumatic for one person might not be traumatic for another, but it absolutely could, in some cases, be very, very traumatic.
I can see there is, we've got a couple of questions now in the Q&A area. Someone's asking, can you go more in depth about the impact of medical trauma on the relationship between the affected individual and the caretaker? Because it's not always the same depending on that type of relationship they have, whether they're a couple, whether it's a parent-child situation, child-parent caregiving, siblings, etc.
I think that's a great question. So give me a second as I organize my thoughts.
Yeah. Yep.
I don't think there's one clear answer here, because each person is different and each experience is different and all the intersectionalities are different. And so even if we were to look at like the dyad of a parent and child, you may have some situations where a parent that look one way, and you might have a situation that looks another way. So I think, I don't know. I want to give more, going back to what I did talk about, that the impact on the caregiver, that caregivers can experience secondary trauma, that caregivers can experience their own trauma, especially if they're also a donor, um, and that caregivers can be a support person to mitigate or reduce the trauma that the person impacted might experience. And that caregivers sometimes, often with the best of intentions, may actually exacerbate the trauma because they're gaslighting, because they say, I don't understand why you don't do this. I don't understand why you do this. I don't understand why you feel that way. You shouldn't feel that way. You should feel grateful because. And that one's often the hardest one to hear. You should feel blank because and the truth is, how somebody feels is how they feel, and we can't should our way out of a feeling. So yeah, I hope that gives enough perspective that that gives a bit more depth. All right.
And someone else is saying, I had a transplant over 15 years ago. I also have several other chronic illnesses and a couple are genetic. I find I'm very irritable with friends, but they don't realize how hard it is to be on one's own all the time, immunosuppressed. Even nurses ask, what's wrong? How do you respond to these questions when there are so many things wrong?
That is an important question. People don't get it. People do not understand. And how do you cope with it when other people don't understand? Ultimately, I can share some options that some people find helpful. And I think ultimately each person needs to figure out for themselves what's going to be or feel most authentic for themselves. Um, so I will say some people are very honest and they say, what's wrong? Well, I feel like garbage right now. What's wrong? I'm worried about what's happening. What's wrong? I'm in a lot of pain. Um, and so some people try to educate the people around them, and that's hard work. And when you're already doing the hard work of living with chronic illnesses, some people don't have the energy to educate the people around them. Um, some people put on a mask and fake it. Some people say, I don't want to talk about it. Some people avoid those interactions as part of their self-care. Some people choose to spend more time with people who do get it. And sometimes that means certain friends, and sometimes that means finding a therapist who gets it. And I will say that even with that, not all therapists understand chronic illness. Um, so if you're exploring therapy, take the time to meet with different therapists and make sure that you're working with somebody who you connect with and you feel like really understands you and believes you, because that's huge. Um, it's hard when people don't understand. It's hard. And sometimes just being able to talk to somebody who acknowledges that and says, yeah, they don't get it, and that's really hard, um, can be helpful. I'm sorry I can't give a more directive, an answer that gives a solution there. Because
Right.
the truth is, you feel the way that you feel, and how you feel is valid. And dealing with other people not getting that is an unfortunate reality that you're kind of stuck
And that probably itself could be a whole other webinar topic
with.
is
Oh, yes. Comes up a
dealing with.
lot in my session. Yes.
Um, we are past the hour, but I just wanted to let people know Joy is okay to continue on, and we're okay to continue on for a few more minutes. So I don't want anyone to feel like you won't be seen or responded to. Someone has said, I've dealt with and I'm still dealing with several medical traumas, including physical assault. I'm not sure if that's from a hospital staff person or at a hospital, but her partner doesn't, or their partner doesn't want to deal with their anger from things, and this person feels isolated. So I'm not
Um,
sure if there's really a question there or if that's just something needing validating, that that's a really difficult
yeah.
to be coping.
I am so sorry that you're dealing with that. Medical trauma is very, very real. And I think that's one of the things that I find particularly challenging with the current definition of PTSD, because I feel like the current definition can invalidate those emotions. Um, and I hear you talking about not just your own experiences and how it's impacting you, but also the impact on your relationship with your partner who, is also struggling in their own way, and the isolation that that's bringing for you. And, all I can say is I'm sorry that you're going through that. And I hope that this presentation has given some thoughts to different options that are available, if you feel like that would be right for you.
And I can see this person has responded a little bit later in the chat to say, where do they go with it? So, you have mentioned several options. One thing I think I wanted to also ask about, because I know if you are actively involved in dialyzing or in the transplant process, often you will have a caseworker or a social worker of some kind. What kind of supports are available to people who are finding themselves already in a medical situation?
I think that's a really good question, and an important one. So yes, transplant teams and dialysis teams have a social worker on staff, almost always, if not always. Um, I've heard very mixed results in terms of how people have found that. I find that they do a good job in connecting people to tangible resources that they need. So, how to pay for medications and how to get assistance with travel, um, sort of those very tangible types of support. Um, I find I've heard a lot of mixed reviews on the emotional support. So, is what it is. Um, a lot of people turn to private therapies for that reason. And so, I do share my contact information here so that if people feel like they want to explore working with a private therapist, you're welcome to reach out and we can talk about what that might look like. Um, Other options, you can go to your GP, and there are some publicly funded therapy options available. They're extremely limited, extremely short term, and often come with a wait list. Um, Go and vote for a party that will stand by the needs of mental health if that's something that's important to you, because that's the most powerful way that we can make systemic change.
I see one more main question.
Mhm.
Someone saying, my husband had a live donor come forward last year. Unfortunately, it fell through during the testing. It was very dramatic. We're now facing, they're getting ready for peritoneal dialysis in March
Mhm.
and feel a lot of stress mounting, and that her husband, who is the one with PKD, doesn't necessarily understand what she's going through. Any suggestions for him?
Um, this is also a loaded question. Because as caregivers, right, I feel like in a lot of ways, your story is kind of similar to mine, that we were both caregivers, are both caregivers in a lot of ways. And, you know, does the person impacted with PKD understand the impact on the caregiver is just as important a question as does the caregiver understand the impact on the person who has PKD? If he's not watching this presentation today, you may want to give him that opportunity once the link goes live. Um, One thing that some people find helpful is if you find a couples therapist who is trauma informed and chronic illness informed, then they can potentially help you work through as a couple that the impact that chronic illness has on each of you individually and as a unit. Because in couples therapy, it's not about any one individual person, but it's about the impact that the things have on your relationship as its own entity. And I'm not suggesting by any means that that's something that you need or should do, because that's nobody could ever make that recommendation based on something that in a chat, but wanted you to know that it's a thing that exists. And a lot of people think about couples counseling as, let's try and save our marriage or whatever that might be. And oftentimes the scope can be very different. It can be, looking at the challenges that you have right now and helping each person in that partnership understand the impact that those challenges have on your relationship right now. It doesn't have to be that a relationship is in crisis to explore support in that way. So I don't know if that sort of was informative, just as another option that exists out there.
One thing, sorry, was there anything else you wanted to say?
I noticed another comment in the chat about someone struggling with false faith and positivity.
Right.
And that comes from the best of intentions and is a form of gaslighting. If you just believe everything will be okay, is a form of gaslighting because it invalidates that your fears are very, very real, and could happen. And so, yes, false positivity and false faith absolutely exist. I want to validate for you that exists. I want to give you another word for it because that is an example of gaslighting. That doesn't mean that you'll choose that when somebody says, oh, just believe in yourself and everything will be great, or, God has a purpose for this and there's a reason. And that doesn't mean that you're going to come back and say, stop gaslighting me. But at least having that language for you may help you to say to yourself or potentially to the person making these comments of, I don't think you're listening to the worries that I have. I know my worries are valid. I know that this could turn out really well and it could also turn out poorly. And I'm worried that both those things are a possibility that I have no control over. So, everybody chooses to address those comments in the way that feels appropriate for them and the relationship of the person they're talking to. But I did want to validate that.
Thanks so much. So I don't see any other questions that we haven't addressed. Thank you, everyone, for sharing your questions with us. And thank you, Joy, for attempting to point people in directions that might be helpful. One thing I'll add for people who may be looking for other kinds of support or looking for support and not feeling like they have access to it. The Kidney Foundation of Canada has several peer support groups that run every month, including one just for PKD patients. And you can find information about that on our website or on their website. And I can also include links to that in the email that I'll send out as a follow-up email. Oh, someone's saying the groups are fantastic. Yes, so I know that person is a wonderful advocate for those support groups. We also have, through the PKD Foundation of Canada, some usually monthly peer chats where we can talk about different kinds of topics. And what we found, we started those last February, the majority of the people who come again and again are interested in topics that have to do with end-stage kidney failure. And whether that's preparing for dialysis or preparing for transplant or just finding a community who understands and gets it post-transplant. So we also have those. And we have one coming up exactly a month from now on March 25th at 12 p.m. again with Joy. So if you wanted to have another chance to talk one-on-one with Joy, that could happen in a month. And the registration link, I can include some information here that I'll just pop in the chat. But that might be another option that you have available to you. We also have My PKD, which is our new online community for people with PKD. And uh, what we're hoping to do, what we've noticed, we've had a great response of people signing up, but we would really love to have an active community on My PKD that, again, is dealing with topics and support for people in stage 4 and stage 5 kidney disease. So if that is something that appeals to you, we're just starting a group within the next week. And if you haven't already signed up for My PKD, feel free to do so. We would love to have you there. And finally, I'd just like to thank Joy one more time. Mention that March is coming up and it's Kidney Month. We'll be having a lot of social media posts about PKD and kidney health awareness. And that's, I think, everything. And I know I've seen a couple more comments pop up. I think that they're thank yous. Awesome. All right. So, and if you ever want to reach out to us for more support, we are always here to try and help you find the resources that you need if we can. And feel free to email us anytime at endpkd@endpkd.ca. I've included that in the chat. Thank you, everyone, and have a great day.
Thank you so much, Michelle. You've done an amazing job organizing this event, and it's always a pleasure to be here with this group, and everything runs so smoothly. I know the video will be online shortly, and I truly appreciate being here. And thanks to all the participants for your excellent and meaningful questions and comments and conversations.